Which of the following is a classic finding on the lateral view of a chest X-ray in a patient with type 3 infracardiac TAPVR? A. A retrosternal clear space. B. A taller heart shadow. C. A distinct lack of a snowman sign, with lungs appearing hazy, ground glass, due to severe pulmonary edema. D. Left atrial enlargement bulging into the esophagus. Answer: C. A distinct lack of a snowman sign, with lungs appearing hazy, ground glass, due to severe pulmonary edema. In TAPVR, the common pulmonary venous chamber or sinus is typically located: A. Anterior to the right atrium. B. Posterior to the left atrium. C. Superior to the aortic arch. D. Inferior to the liver. Answer: B. Posterior to the left atrium. Why is the vertical vein in supracardiac TAPVR often referred to as a left superior vena cava, LSVC, equivalent? A. It carries deoxygenated blood to the lungs. B. It follows a similar anatomical course on the left side of the mediastinum but carries oxygenated blood upward. C. It always connects directly to the left atrium. D. It is formed by the persistent right cardinal vein. Answer: B. It follows a similar anatomical course on the left side of the mediastinum but carries oxygenated blood upward. In cardiac type TAPVR, the pulmonary veins most commonly drain into the coronary sinus. This results in A. Dilatation of the coronary sinus and the right atrium. B. A massive left-to-right shunt at the ventricular level. C. Narrowing of the tricuspid valve. D. Ischemia of the left ventricle. Answer: A. Dilatation of the coronary sinus and the right atrium. During the neonatal period, which factor most significantly determines the severity of cyanosis in TAPVR? A. The size of the left ventricle. B. The degree of obstruction to pulmonary venous flow. C. The presence of a VSD. D. The infant's birth weight. Answer: B. The degree of obstruction to pulmonary venous flow. In the mixed type of TAPVR, what is the most common anatomical combination? A. All veins to the portal vein. B. Left pulmonary veins to the left innominate vein and right pulmonary veins to the right atrium or coronary sinus. C. All veins to the azygous vein. D. A single vein to the left atrium and the rest to the IVC. Answer: B. Left pulmonary veins to the left innominate vein and right pulmonary veins to the right atrium or coronary sinus. What is the Ward-Matthews sign, sometimes seen in obstructive TAPVR? A. A specific type of heart murmur. B. Notching of the ribs. C. Rapidly progressive pulmonary edema with a relatively small heart size on X-ray. D. Bounding carotid pulses. Answer: C. Rapidly progressive pulmonary edema with a relatively small heart size on X-ray. When performing an anastomosis between the common pulmonary venous sinus and the left atrium, surgeons must be careful to avoid A. The phrenic nerve. B. The SA node and the mitral valve apparatus. C. The thoracic duct. D. The recurrent laryngeal nerve. Answer: B. The SA node and the mitral valve apparatus. In patients with non-obstructed TAPVR, the pulmonary artery pressure is usually A. Low or normal. B. Mildly to moderately elevated due to high pulmonary blood flow. C. Higher than systemic pressure. D. 0. Answer: B. Mildly to moderately elevated due to high pulmonary blood flow. Which of the following is a potential late complication, years later, following successful TAPVR repair? A. Supraventricular arrhythmias, such as atrial flutter or AFib. B. Systemic hypertension. C. Aortic root dilation. D. Pulmonary valve prolapse. Answer: A. Supraventricular arrhythmias, such as atrial flutter or AFib. In infracardiac TAPVR, the vertical vein descends through the diaphragm alongside which structure? A. The phrenic nerve. B. The esophagus. C. The aorta. D. The vena cava. Answer: B. The esophagus. If an infant with TAPVR has a very small, restrictive atrial septal defect, ASD, they will present with A. High systemic blood pressure. B. Severe low cardiac output and systemic shock. C. Excessive left-to-right shunting. D. Left ventricular hypertrophy. Answer, B. Severe low cardiac output and systemic shock. What is the primary reason for the figure of 8 appearance in supracardiac TAPVR? A. The combination of a dilated SVC and left vertical vein, top, and the dilated right heart, bottom. B. The presence of 2 separate hearts. C. Dilation of the pulmonary trunk and the aorta. D. Rib notching and cardiomegaly. Answer, A. The combination of a dilated SVC and left vertical vein, top, and the dilated right heart, bottom. In the context of TAPVR, what does the term obligatory shunt refer to? A. The blood must flow through the PDA. B. All systemic and pulmonary venous blood must mix in the right atrium before crossing the ASD to the left side. C. Blood must flow through a VSD to survive. D. The lungs are bypassed entirely. Answer, B. All systemic and pulmonary venous blood must mix in the right atrium before crossing the ASD to the left side. Pathologically, what happens to the pulmonary arterioles in long-standing, unrepaired TAPVR? A. They become thin and dilated. B. They develop medial hypertrophy and intimal hyperplasia, Eisenmenger-like changes. C. They disappear entirely. D. They develop valves to prevent backflow. Answer, B. They develop medial hypertrophy and intimal hyperplasia, Eisenmenger-like changes.